My name is Andrew Cluley. I'm the Director of Communications for the Ann Arbor Public Schools. We'll start off. We're going to have a quick introduction of the panel here. Dr. Swift will have a little bit of an update, and then we'll get right into the questions and answering session. So without any further ado, I'm going to invite Dr. Swift and the rest of the panels, starting with the trustees, to introduce themselves.
Good evening, everyone, and Happy New Year. I'm Brian Johnson. I am the president of the Ann Arbor Public Schools Board of Education. I'm really excited to be here with you tonight.
Good evening, everybody. Jessica Kelly, Vice President of the Board of Education.
Good evening and Happy New Year. Rebecca Lazarus, Treasurer of Board of Education.
Well, thank you all for being here this evening. I'm Janice Swift, the Superintendent of Schools, and I'm honored to be joined by the folks on the screen and so many of you from the community. I'll have members of our P12 school leadership team introduce themselves so that you know who we have with us on this panel this evening.
Good evening, everyone. Dawn Linden, Assistant Superintendent for Teaching and Learning.
Good evening, Jazz Parks, Assistant Superintendent of School Leadership.
Good evening, everybody. My name is Matt Hilton. I'm the Executive Director for Elementary Education.
Good evening, everyone, and welcome. I'm Roberta Hayward. I'm the Executive Director for Middle Level and K-8 Education.
Good evening, everyone. My name is Paula DeAngelis. I'm the Executive Director for High School Education.
Good evening, everyone. I'm Mary Ann Fedician. I'm the Executive Director for Student Intervention and Support Services.
Very good. Thank you. I appreciate you all joining us this evening. I think the way we'll approach it is I'll give a brief update, spend a few minutes talking about where we've been, where we are, and our next steps moving forward here in January. Then we'll jump right into the questions, and I appreciate the trustees and members of our team joining us. Mr. Cluley will be watching your questions. We've already prepared for some of the most commonly asked questions. We've received many emails, and although we aren't always able to respond to every individual email, we do note the commonly asked questions and concerns so that we can address them in forums just like this. So we so appreciate all of you being here this evening. We appreciate the efforts of our students, teachers, and staff, our parents and families to begin this January of 2022. We began today, as you all are aware, in virtual learning. Certainly, this is not our first choice. It's not our ideal choice, yet I'm extremely proud of a strong beginning today on virtual learning with high levels of student attendance. We were between 90 and 91% of students attending across our classrooms at elementary, middle, and high school today across our virtual classrooms. Many thanks to everyone. I know there were a lot of sacrifices made for folks to get the technology and make sure they were all set to go. And I really appreciate the efforts of our technology team. They received more than 800 help desk calls and processed them today. I'm very grateful that our teachers and staff have again made a transition to support a continuity of learning on days when in-school learning is a challenge. And again, thanks to our students and parents for making this work. We continue our strong commitment to in-school learning, to have our students and staff together for in-school learning throughout this school year. And we are focused on navigating the challenges that we face in order to achieve as many in-school learning days as possible. We are not in the situation we were in a year ago. And I know that when we shared the information on Friday evening, it was very alarming to many folks because they felt like we were back where we were a year ago. I do understand that feeling. We feel it too sometimes. But I want to clarify, we are not where we were a year ago. We're in a dramatically improved situation with tools, experience, information to reduce the risk of transmission in our schools. We've been working with many layers of support against COVID transmission in order to keep our students and staff safely learning in school. Just some of those tools, and I was delighted to see this evening that we've received the final confirmation that 12 to 15-year-old boosters will be approved. So again, another layer of protection for us. We have a high-performing nurse and health team to conduct our case identification and management support. We've achieved high vaccination rates at ages 5 years and above in our county. Our AAPS staff is the most highly vaccinated staff I know of among those in the state and across the country. If you've not seen it, we'll post it again this evening, but we issued a report not long ago, and you'll note that our AAPS in-school teaching and learning staff were at about 96% vaccinated. That's another layer of support for in-school learning. We've been practicing universal indoor masking and our Super 6 mitigation strategies. And boosters are now available for 16 years and above, and over the coming days, just brand new, hot off the press approval for 12 to 15-year-olds. So together, we have laid a strong foundation for this 21-22 school year. During those weeks between August 30th and December 17th, the beginning of winter break, we achieved 71 of 75 days of in-school learning together. And together we will again overcome these current challenges, and we will continue our in-school learning this school year. So let's talk just for a minute about our current situation. I imagine that you're all aware, but I just want to share the data and the facts as we see them and as we are experiencing them with our own AAPS staff. Over recent days, a dramatic rise in the number of COVID cases, and specifically, we are focused on the impact of that increase in cases on our ability to safely staff our schools with professional and support staff and with our operations staff to ensure a safe operation of schools. This week, we have modified the return from winter break to transition through a virtual setting Wednesday through Friday of this week. And that is designed to help us mitigate this COVID transmission amid the post-holiday time. And again, I do appreciate the hard work and sacrifice of everyone to make it happen as we work through this transition and move forward in this new year. So it is important to think about our AAPS operations when we consider the impact of the dramatic rise in COVID cases. It directly impacts every part of our operations for in-school learning. And just to think a little bit about the scope of our operations, it's approximately 3,000 team members, teachers and support staff, nurses, food and nutrition team, custodial, transportation, technology, and many other team members. Every one of those team members is key and critical. They are integral to successfully operating our schools each day. The operating of our schools and includes the staffing of approximately 1,200 classrooms across 31 school locations. It involves preparing and serving more than 15,000 meals each day, cleaning 3.5 million square feet of space, and operating 131 buses, transporting our students approximately 8,500 miles to and from school each day. I don't note the expanse and the scope of our operations as an excuse, but yet it is a part of our reality. And our current reality is that every one of those areas is impacted by this dramatic escalation in COVID cases driven by the Omicron variant. So what are we facing now as we sit here on January 5th, Wednesday, and we look ahead over the coming weeks? We understand from our experience over this previous week and from public health experts that the significant uptick in the number of COVID cases represented in the surge we've seen these previous days, this is unlike anything we've seen previously during the pandemic. We understand that this is likely to extend a few weeks through January. None of us knows that. None of us has a perfect crystal ball, but that is what we're understanding. And this surge creates conditions where we will struggle, despite our best efforts and all of our preparations over the previous year. We will struggle to staff our schools adequately for a safe and secure opening. This is due to absenteeism resulting from the cascade of COVID cases among staff. It has to do with the mandatory days, number of days of isolation. It has to do with those who are absent due to caring for an immediate family member. And all of that comes on top of just the normal day-to-day absences that are necessary here and there for everyone who works in the organization. The encouraging news is that vaccination and boosters are our best protection from serious illness and hospitalization. And yet we will continue to face a disruption caused by the volume of spreading illness and a related storm of absenteeism. It is important that we absolutely set out those facts tonight. I want to assure you all that we will continue to hold the priority of having our students and staff in person, in school learning as our top priority behind health and safety in safely staffing our schools. We will use every one of the tools available to us, and I'm proud that our staff and our students, our community, I received so many emails from folks saying we've taken every step to support this effort. And I want you to know that is a precious shared effort that we're all working toward, is keeping our staff, our students, our schools, and our community safe and learning together. So what are our next steps? This week, over this past week, we have modified the reentry with a temporary transition to virtual learning from winter break to allow for the assessment of our specific data on our current staff impact, to mitigate the post-holiday surge, and to ensure that we are fully scaled to continue with virtual learning when it is needed in the case of an emergency safety measure due to increased reported positive tests among our staff or other COVID-related concerns. So this week, staff COVID cases, we are processing them even now as we speak. This effort literally goes on around the clock, 7 days a week. This week, staff COVID cases number many times the number of any prior week that we have experienced until now. We will issue a report as we do every Friday, so that data will be public as to our number of staff cases. Our nurses are currently now confirming with each and every staff member who has tested positive the exact number of days of isolation, and the nurses are working with folks to clarify their earliest possible return dates. And we are making those arrangements with principals, with our HR team, to ensure that we have every position covered to the very best of our ability. We've conducted COVID testing this past Monday discovered positive cases there that we're addressing. The Washtenaw County Health Department will host a testing event tomorrow evening. I understand that that event is filled. And then I'm pleased to be able to share that Ms. Bacalor and our nurse and health support team will offer a testing event for staff on Friday, offering approximately 1,000 additional tests for staff on this Friday, free at no charge, so that our staff, if they choose to, may be tested before or after their teaching day on Friday, their virtual teaching day on Friday. So based on the outcome of this Ann Arbor Public Schools testing data and the analysis of the earliest possible return dates for teachers and staff who are impacted by positive COVID tests, we will provide an update by this Friday as to when we will be able to transition our schools from virtual to in-school learning. That is our focus priority. This decision will be based directly on our ability to safely staff our schools for in-school operations. Moving forward, when an emergency safety measure is necessary due to a staffing issue, we will transition to virtual learning. The transition to virtual decisions will be made on a classroom, grade level, or school by school basis. And they will be based directly on the ability to staff schools for safe operation, on high numbers of COVID-19 cases within a particular classroom or grade level or school. And they will be based on guidance provided by the Washtenaw County Health Department in response to any particular COVID outbreak situation. I want you to know that I very much hear and resonate with the huge concern around last minute notice of transition to virtual. I do understand the concern. These notices are hard for everyone, our families, our students, our staff, our community. We are doing everything in our power. We are monitoring staff as they fall ill, in attendance around the clock, 7 days a week, to determine the viability of school operations as early in the process as is possible. And yet these situations can sometimes change dramatically within a few hours or within a day, as they did over last Thursday and Friday. We are always going to do everything we can to achieve in-school learning. So we are not going to give up on that until we do not have another option. So the most important ways, I'm so appreciative of all the emails that we received saying, how can we help? We want to help. I so appreciate that. And the most important ways that our students and staff, families, and community can help to support this critical effort of having our schools be open and safely operating is to ensure vaccinations and boosters. And secondly, to monitor daily for any symptoms. And students or staff, families who are experiencing symptoms must remain home regardless of vaccination status. So I hope that this brief introduction has been helpful to understand that this transition to virtual is a temporary situation. We are working through the steps that we need to take in order to have our default moving forward, January through June, to be schools open. But in order to do that, we must determine and support our staff as they experience COVID and how we can ensure that our schools are adequately and appropriately professionally staffed so that we can get our in-school doors open. So I hope that's helpful. And Andrew, I know we're going to transition over to questions.
We'll jump right into the questions. First question, what updates can you share about efforts in progress with COVID testing in the Ann Arbor Public Schools?
Sure, Mr. Cooley, I can address that. First of all, just to reiterate what Dr. Swift shared in her remarks, we certainly understand that many local testing resources have significant wait times right now. So to that end, Ms. Bacalor and her COVID response team are offering free rapid antigen testing up to 1,000 district staff and students this Friday. And we continue to require weekly testing of our unvaccinated staff and our contractors. Also, to support our families with testing, the district has registered for the state's backpack testing program for parents to be able to use at home. And when we get word from the Michigan Department of Health and Human Services as to when those testing kits will be shipped, we will most certainly update our families with more specific information.
Excellent. I also saw questions about the backpack program, so it's good to hear that we're working on it and we're just waiting on word from the state. Next question, why don't we just mandate vaccines for all students and staff immediately so we can get past the pandemic?
Mr. Cluley, I really appreciate folks have written in with that question. We took a stand early last July to require our staff to submit proof of vaccination or prepare to test weekly. And that has been our operating rhythm throughout the year. Folks ask us all the time, let's just mandate for students so that we could get on with things and get past this part of the pandemic. And it turns out that school district really doesn't have oversight over vaccine requirements. That really does fall under the Michigan Department of Health and Human Services. That is the agency with the authority to mandate student vaccines. And the requirement for students to be vaccinated against COVID is not within the purview of the school district. Now, we are monitoring if that should change. We certainly will follow through as we do with all of our other childhood vaccines, but at this time, we've not received that direction yet.
Okay. We've got a couple of different questions, all basically asking the same thing. Maybe two different variations, but I'll share them both. What if I prefer for my child to complete assignments and not participate in Zoom on virtual days? And then kind of tied into that also, why are we not doing the virtual schedule like we had it last year with sort of much more of a asynchronous time and whatnot? So both of those questions sort of come together.
Thank you, Mr. Cluley. I'm happy to answer that question. First of all, parents always have the decision-making capability. And if they feel that the Zoom delivery or the inclement weather issue or whatever it is that may be a barrier for them and their families may prevent them from being on a live Zoom, they always have the ability to keep their students off of the Zoom. Please know that when the district is on virtual live days, that the state of Michigan requires us to take attendance in much the same way we do in an in-person situation. So that means students are on at the start of school. They are in a live Zoom with their teachers. Their teachers take attendance. If a student isn't present in the live Zoom, then they will be marked absent, just like they would if they were not present in class. So that's a distinction that I think families should know. But please know that anytime students miss a live video conference or are not part of that class session, their work is always accepted, credit is always issued and given. So the grade piece of this is not in question. Our teachers and our administrators work very hard to ensure that students do not fall behind and they have every ability to stay on track with their learning. And you'll probably hear more of this from our executive directors if other questions do come up. As far as the schedule goes, we are required by the state of Michigan to observe a full school day. So for secondary, that means that students are expected to log into their live video conference at the start of every hour or every class period. It is up to the teachers in their purview of the lesson at any time during the lesson to allow students to work independently on a particular assignment. So there will be some variations from class to class as to how long a student stays on Zoom. At the elementary level, again, we're required to observe a regular and full day. However, just like in an in-person setting, there are recesses, there are breaks, there are moments when students work independently, and those are times when students will be off Zoom. So those are times when the classroom teacher will communicate that schedule directly to their families, and they already have done so this week. So any variations that families may be experiencing between one student and another, it's because of the teacher discretion, when the lunch period may fall, when their special area class may take place, when recess happens, and when the independent work time is taking place. Those are all times when a student would exit the teacher's classroom and be off the teacher's Zoom call. So I hope that helps explain a little bit, Mr. Cluley.
Thank you.
Andrew, before you go to the next question, just to be clear, Ms. Linden, when you talk about absences and you said that a student will be marked absent if they don't take attendance, parents will need to approve those absences just as if they were absent from in-person school as well. So I did.
That's correct.
Want to bring that up. Thanks.
That's correct. Thank you, President Johnson. Anytime a student will be absent from in-person or live Zoom, we do ask that parents call and report that absent to the school office. Thank you.
Okay, the next question. How will special education services be provided on the days while we're in virtual learning?
Hi, Mr. Cluley. I will take that question for you. Good evening, everyone. As far as special education services, they will continue as scheduled via live video conferencing. The amount of time spent in live instruction with our students is based on the need, student stamina, and also teacher discretion. Staff may push into classes via Zoom for inclusion and also use breakout rooms when appropriate.
Thank you, Dr. Fedician. Next, how are students being supported during this time?
So, Andrew, I can jump in there and speak to that a little bit from an elementary perspective to start. Certainly, we always want all of our students to feel supported throughout each and every day in our schools. And so during this time, we accomplish this in a few ways. We accomplish it through frequent communication and outreach to families to ensure access and resources. But we also will be supporting students through the social and emotional connections that we foster in our grade level, in our classroom morning meetings, in our classroom closing circles, and certainly in our small group times. And lastly, I would want all families to know that certainly our administrators and our intervention specialists and special education staff and other building support staff will be reaching out to families and students as needed to support academic and social and emotional learning connections each and every day.
I can talk about middle school, and I'll just reiterate what Dawn Linden has shared previously. Our students' virtual school day follows their respective in-person learning bell schedule. So during this time, students do attend all of their scheduled classes, including breaks and lunch at the middle school level. After instruction and check-in with their teachers, and based on assigned lessons, teachers will allow students to engage in such activities as entering breakout rooms for additional support, meeting in those small groups, or work independently offline. Computer breaks are essential and are provided throughout the school day.
Andrew, I'll just add a few things, and I think Matt and Roberta have summed up much of what the high school experience looks like as well. Our intervention specialists and our other support staff are reaching out to families to make sure that we're providing for the needs that families may have during this week of virtual learning. Our media specialists have joined with IDT to provide technical support for families that need that. One of the things that is specific to 3 of our high schools in terms of supporting students, the 3 that are on semesters, Community, Huron, and Pioneer, we're taking great care to begin communicating with students about the expectations of completing this first semester and preparing students for the exam week, which is coming up on January 18th. So a lot of the same work going on and just a lot of care from not only the teacher level, but our interventionists and support staff to make sure that we're meeting the needs of students.
Thank you all. We've got another question. I think about sort of the mechanics of being in a synchronous virtual and wondering, can we switch from that to a short-term stint on asynchronous A2V while the rest of the district is remote?
Mr. Cooley, I can address that question. So short-term enrollment in A2V, which is an asynchronous program, is not recommended by either us as a district or the Michigan Department of Education. The reason being is that the curriculum is different and the alignment of instruction and the progress are not coherent between both the A2V and our classroom-based instruction. So the courses are designed in A2V for completion over the course of a semester or term, not short-term engagement in that type of learning. So families wishing to make a shift to A2 virtual, asynchronous enrollment can do so at the semester shift. And the commitment would be to completing an entire second semester in that A2V program. And so for families who are interested in an elementary A2V option, we will work with families to support that on a case-by-case basis as our space available allows. And so connecting with our principal for that program, Mrs. Robin Coker, is the best option and recourse for families who are interested in that.
Thank you. And what's being done to make sure that the Zoom classrooms are safe and secure for students?
Thank you, Mr. Cluley. I'll take this question. It's something that we've worked very hard to ensure over the course of our experiences in virtual instruction. And so fortunately, we have great experience with this and our teachers know exactly what to do. But they follow a prescribed checklist every time they set up a Zoom call to ensure that the Zoom is secure. And this means that students are authenticated and no one who is not authenticated or invited is able to attend. And so in those ways, the Zoom setting is secure. Happy to share more detail with folks, and we certainly have more information down the line.
And Andrew, before we leave that topic that Ms. Parks was just on about the questions from parents who may be with this Omicron surge thinking about a transition to virtual. I know we don't have very many spaces left in the elementary version, but if folks wanted to inquire about that, Mr. Hilton, Ms. Parks, what would you recommend?
Dr. Swift, I can speak to that initially, and then Jazz, you can fill in as well. I think the very best thing that they could do in this moment is reach out to Robin Coker, who is the principal of the A2 virtual program at elementary. And she'd be the point person who would be able to help best in this moment.
Thank you.
Next, we've got a series of questions. Basically, what was the data that was used?
Yes.
How did we know that on the 31st that we wouldn't be okay this week, but we thought that we might be next week? Series of questions about that.
Thank you, Mr. Cluley. I'll start that. I really appreciate those questions. The data that we are using really is one metric, and that is the direct impact of COVID transmission COVID infections among our staff and our ability to staff buildings. So we knew over the course of, we became aware over the course of Friday that there was looked to be significant impact into our schools broadly. And this absolutely mirrors the increase, really a stunning increase in numbers that we witnessed last Thursday and Friday in the county. The second piece of data that we're using is this analysis that our nursing and health team are completing by contacting every staff member who has reported a positive case to really to determine when their days of isolation will be completed. Now, of course, we're hoping that they recover and that they feel well, because we have had experiences where some staff members need a little bit longer to recover. We also, so that is the second component of the data picture. And then, yes, as someone has inquired about the data from these testing events that we've held, our Monday testing event, the testing event tomorrow evening, Washtenaw County Health Department, and our own staff testing coming up this Friday. All of that data will further inform if we are able to move forward on Monday or in how many schools. Our default setting, as soon as we can mobilize and move through this surge, is to be open. And yet, and what I would say directly to President Biden is we absolutely agree. No one agrees more than educators and parents and all of us in the community that our students and our teachers need to be in school learning. That is a natural habitat of public schools. That's where we want and choose to be. On the other hand, it is not possible to open a school unless we can do so safely. So we will analyze our own data. This is not like a year ago where we're looking at county data or we're looking at state or national data. We are looking at our own data right here as to the impact of our own staff, and we will make those decisions accordingly. Our intention is to get the district to in-school learning. But our advisement this evening is there may be days when we're not able to give bus service. There may be days when operations are modified. And there may be days by classroom, by grade level, or by school where we need to attend virtually rather than in person. So that is our current reality. And we surely hope that all the layers that we have in place are going to benefit us and we can move through this chapter, hopefully very quickly and move forward with robust in-school learning as we have been doing throughout the fall. I also want to touch on athletics real quickly. Mr. Cluley, I know and do resonate with that concern of athletics continuing their participation. And we will continue to monitor that situation very closely. We do have our academic teams and other teams that are also continuing their work together. Those students have submitted proof of testing, or they're submitting for testing, proof of vaccination, or they're submitting for testing every week. So we do have a level of high levels of vaccination assured in those groups, but we will continue to monitor that very closely. And we will suspend those activities if we see the data coming out of those specific locations. So I hope that's helpful, Andrew.
Yes, it was. Answered several questions at once. Another question, and I think you've basically answered this, but maybe they got it in at the very beginning of the session, it looks like maybe. But instead of shutting down the entire district, is there thought to a more targeted approach to moving some classrooms of schools online as needed for staffing?
Yes, I really appreciate that question. That is our rhythm moving forward. And yet we do need to stabilize this very significant post-holiday impact to our staff. So we will update on Friday based on the data that we are seeing out of these, it's a few thousand tests really that have occurred over the course of several days. And we will, the wait times on test results are, in some cases are taking a few days, but as soon as we have our updated data, we will advise and update our community. We know that folks need to know how to plan, and we're working every day to make sure that we can give that update as soon as we responsibly can do so.
Dr. Swift, just a question and a clarification, because we talk to you a lot and you talk about this being our rhythm. And I think, specifically what you're saying is that we have been going to virtual classrooms. We have been shutting down specific schools or specific classrooms throughout. So this idea that the question addresses, it does happen, and it has been happening, and we don't always close school altogether when we have cases. Can you talk a little bit about when is that decision made to make a district-wide, to do a district-wide closure? So what's the calculus that goes into that decision?
It's when operations are threatened by the inability to staff in most locations. And that's what we saw the end of last week, is every school was going to be impacted. And it's at that point that we will need to make the decision to have the district be virtual. We hope once we stabilize just a bit to not have to return to a full district situation. And yet we've learned a long time ago, none of us has a crystal ball when it comes to the kinds of challenges that are emerging day by day, week by week throughout this time.
Okay, next question. How are we able to staff for virtual learning if we don't have enough staff to have in-person school?
We actually have, that is an interesting question, and I appreciate it. We actually, for example, today and tomorrow and Friday, we will achieve higher attendance rates because we're virtual. That's just a phenomena of it, because there are many staff members who, if we were in person this week, would still have to be observing their days of isolation, but they are home and they are teaching even though they're in isolation. So virtual instruction is not impacted as directly. It's impacted really more simply by those folks who are so ill that they cannot work. But a large number of our absences are around, just like you see in the community, folks who have to observe days of isolation and some days of quarantine, et cetera.
Okay. We've got several different questions asked different ways, but essentially they come down to what is the status in terms of how these days count and whether or not we're going to have to extend the school year?
I really appreciate that question. I meant to share it in my opening. We are currently at 6 days for the district. 6 days are allotted as act of God days by the state. The state also allows us to apply for 3 additional days. So we so far are okay. And by having this virtual option now ready to go, it will be our intention then to remain in good shape throughout the balance of the school year and not to need to extend into the summer. If we get to that place, of course, we're going to continue to update our students, our staff, our families, our community. But at this time, we are okay on our status of days used for this school year.
Okay, next one. Based on the experience last year with the synchronous online learning, why were we not able to use the 6 days that we've been out? Why did we not just go straight to synchronous online learning this year to cover those days as well?
Some of it has to do with the readiness and the ability this year. We had devices returned at the end of last year and devices reissued at the start of this year. You've seen our staffing challenges. So throughout the fall, we were hiring new staff and ensuring staff training. And a lot is involved in the training of staff for in-person learning, let alone preparation for remote. So that was ongoing throughout. And also trying to ensure connectivity and other issues were in place for all of our students. So a lot of that setup and preparation was going on through Thanksgiving break when some of those closures were happening.
I appreciate that. I do want to mention, if it's okay, Andrew, and I should have included it also in the introduction, we have made additional orders over Christmas and New Year week for additional supplies of the KN95 masks. We do have confirmation that those will be delivered to buildings prior to Monday. So I appreciate the work of Liz Margolis, our student safety officer, and Ms. Jenna Bacalor and Jill Minnick. We do have that appropriated. We also have had, and our buildings are freshly stocked with surgical masks that can be layered with cloth masks. So there are a number of options available. We are vigorously taking steps every day to ensure as much testing as we possibly can provide. We have applied for testing and requested testing from every entity in the state. And you'll hear more day by day as we're able to secure those testing opportunities. We are not the beneficiaries of the kind of hospital network partnership that Detroit Public Schools benefits from. That is a wonderful partnership, but we do have options and we are working those every day and we'll continue to announce them. We appreciate our partnership with MDHHS, and we've offered, I think now it's about 8 separate vaccine and booster clinics on site. We offered one of those just last night, and we're able to give more than 120 student vaccines and boosters and a set of staff boosters as well. And I just want to give a shout out to MDHHS and to our nursing, AAPS health and nursing team, because they've done just incredible work to staff all of those events so that we can get as many folks vaccinated. And I had the great opportunity to be in some of those and heard directly from parents how convenient it is to get that vaccine or get the test right at school. So we will continue to do all of that we possibly can.
I have a question here, a couple of different versions of it, but basically thoughts about staying virtual longer instead of opening up to the possibility of coming back and having kids coming back and forth between virtual and not virtual.
That is the concern. And wow, do I appreciate you raising it, community. We do want to avoid the yo-yo, the in and out, that is very disruptive. But we also feel very strongly that the setting needs to be to in-school learning. And then moving to virtual as needed for a period of days, if needed, at the school level, at the grade level, at the classroom level. We prefer for it to be that way as opposed to the default being virtual. So I'm not sure if that makes sense to folks, but that is our goal. So we want to stabilize this post-holiday surge among our staff. We're going to collect data to see where we are with that. And as soon as possible, accomplish that transition to in-school learning with the understanding that then we will be making school by school decisions, classroom by classroom, as is needed.
Okay. Question regarding getting more subs in. Basically, is the district doing anything along the lines of the legislation that was just signed into law by the governor to basically make anyone working for the district eligible to be a sub?
Yes, we have we have month after month increased our sub pool. And for all of you out there who have taken time off your jobs and other responsibilities to sign up to substitute in our Ann Arbor Public Schools, we're so grateful for your support. So we are widening that net. We do have a good, strong pool of substitutes. And I should have also mentioned earlier, we are now confirming the impact of this COVID increase on the subpool as well. That's another question that we're working to get the answer to, because we want to have our building subs and our daily subs. We have about between 300 and 400 folks who work with us on a regular basis. We want to have those folks ready to go. And we understand that as COVID impacts, it will also impact that group as well.
Okay. Will AAPS hold an additional vaccine clinic to include administering boosters for 12 to 15-year-olds once it's finally approved?
We are absolutely have made that request. I know that MDHHS is working hard to schedule their third-party contractor team that we continue to work with, but we are asking for any and all events that they're able to support in our schools. So, and I know we were in meetings this morning with Washtenaw County Health Department, and they also expressed a commitment to support getting as many vaccine booster clinics. We know these boosters will really help our middle schools and even Mr. DeAngelis, our 9th grade. So we want to get the boosters rolling out just as quickly as possible, as widely as possible. And we'll do everything that we can in that effort.
Okay. Are you following the revised 5-day CDC quarantine timeframe for staff?
I am so glad that someone asked that. We are awaiting updated guidance. I did include this in the Friday message, and I just need to share an update. We do anticipate updated guidance from Washtenaw County Health Department. It is not out yet and is still being finalized on the advisement of Michigan Department of Health and Human Services. So we expect that to roll out, and it will impact whether it is the 5-day or the 10-day. As you all are aware, there's a lot of discussion. And remember, school guidance is always distinct from general population guidance. So we are awaiting that confirmation, and please look for communication from us. But we do expect the school guidance to be adjusted. We don't know all of those details yet. And I do have from Ms. Bacalor that we have been approved for 3 more vaccination clinics. That's just hot off the press. So I'm really delighted that we'll be able to continue that effort right in our Ann Arbor Public Schools.
That's great news to hear. Next question, again, is one that has been phrased in a bunch of different ways, but essentially, will you be / why have you not been prioritizing keeping the youngest kids in the schools, and if necessary, shifting staff from the older grades to the younger grades to make that possible?
We absolutely want to prioritize our youngest learners when that is possible. We absolutely agree that that is a priority. We have not had days where it was simple enough, the algorithm, to simply staff elementary by keeping secondary virtual. But I know I worked with this team and other members of the team for hours and hours on looking at how we will analyze, and we will be analyzing toward our youngest learners who have more difficulty accessing virtual learning. But I tell you, I just am being very frank here. Every time I say that, we all know that there are middle level and high school learners who are at extreme risk as well and need to be in school also. So I just want to acknowledge that component as well.
Next question. Again, this is another one that's phrased a bunch of different ways. So I'll just sort of create a overall question. What are the specific things that have made it so that staffing has been a bigger challenge in Ann Arbor than some of the other districts, either locally or throughout the state, so that we've had some more days where we've been out than many of these other districts?
Well, I appreciate that question. I meet with superintendents literally daily, and interact with them daily, and meet with them a couple times a week. And I can tell you there's not a district out there that has not been significantly impacted by staffing. Now, we do have some guidelines that we've tried to hold to, and I'm not saying anything about any other district. We are focused on our district, but we have not gone to congregating large numbers of students in a cafeteria or in an area because we didn't have teachers. We have really tried to hold to that priority that we want our students in classrooms learning from highly qualified teachers. If we are going to get to the point where we make some of those compromises, that will be something that I'll want to share with our parents and with our community, because up until this time, we have really felt that we wanted to staff our buildings. We're grateful that many on our team have worked extra duty hours on their planning time. They've come in early, they've stayed late in order to help bridge these gaps during the school day. But we are doing everything we can to staff our buildings. And when we are unable to staff, then we have to make what is for everyone the decision that, we wish we didn't have to do. And that will be to go virtual.
Okay. Per state regulations, how many virtual days is AAPS allowed?
I don't believe that there is a real quantitative answer to that. Ms. Linden, you're the one who, okay.
No, during this pandemic, the state of Michigan allows school districts to shift to live synchronous instruction to keep staff, students safe and to operate safely. So there's no limit on the number of live synchronous learning days following the schedule that is established, a same schedule as in person. You may be, I don't know if this individual is asking about emergency closure days. There's a limit to those.
No,
Okay.
No, they very specifically said virtual learning days.
Got it. Thank you.
I will address the concerns about folks have already set up their travel plans for, mid-June. And of course, we publish the calendar and families plan around that. And I just want to reiterate that we've not used all of our days at this point in terms of what the state will allow us. And we're going to do everything in our power, our staff, our students, our parents, and our community to hold to that June date. And if anything about that changes, we will communicate that just as quickly and just as early as we possibly can. But we have used 6 days. The state automatically allows for application for 3 additional days. So that is the current status of where we are in the Ann Arbor Public Schools.
Okay, a question. Based on the testing results, you said we will decide based on the testing results on Friday. That'll be one of the factors that we'll consider. Basically, they're asking how close are we right now to the metrics? And are there specific schools that we know are at a greater risk of not being able to reopen than others?
We are still deep in analysis and waiting on test results from staff members widely. So we're not at the point where we can give a clear indication on that. We will update the community on Friday. By that time, we'll be working with whatever data has come through, particularly the case data that we're waiting on now, and then also the results. That 1,000 tests on Friday are rapid tests. So we will have that data. As we move through the day, Friday, we'll be receiving that data. So,
is there testing for students as well as the staff, or are we, when we're talking about the Friday, are we just talking staff?
The Friday event is for staff. We continue to conduct responsive testing in the district for students. Our nursing team is doing that as they see needs arise. We have not been equipped, and we've done everything in our power to try to get the capacity, but we are not equipped either with tests or with personnel to give, say, for every staff member and every student would be about 22,000 tests a week. That's an endeavor that, we're not able to do. But we will continue to monitor closely. We will give testing as we're able to when we see the need arising in schools, but being able to test everyone on a daily or weekly basis is not a part of what's been provided for Michigan public schools.
Okay, here's a question. Now that so many more kids are fully vaccinated, please reshare the policy for vaccinated students who are close contacts. Obviously, that's once we're back in person.
Mm-hmm. So that'll be a part of the guidance from the Washtenaw County Health Department that we are waiting. They're finalizing that now. But there will be, as I believe everyone understands, a distinction. Students who are vaccinated, there'll be a distinction in that guidance. And I don't want to say what it is because we're still waiting for that to settle out. And we're looking for that coming from Washtenaw County Health Department, how that, once a case is identified, how that looks for close contacts, those close contacts on the bus or in the lunchroom or in the classroom or in the activities outside of school, et cetera. Yeah.
Okay. Question about learning loss. How has the Ann Arbor Public Schools assessed learning loss over the last 2 years?
Yes, really appreciate that. Dawn, will you start? And I know others will add.
Happy to. This is probably an hour-long response tonight alone, but the look into how students are doing is often and frequent and vast. We do have our measures of standardized assessments that we deliver, but we also have formative assessments that we deliver every week to assess where students are. And so many measures have been put in place to support our students, from targeted skills group at the elementary level, particularly around the development of literacy, to assessing diverging and unique mathematics supports needs for students, to credit recovery happening in the moment, the minute students begin to fall behind or indicate that they may need extra support, to at-home visits, to the list goes on and on. In addition to individualized and assessment-related targeted supports for students, we also have revised our scope and sequence for our courses, focusing on foundational skills, making space for makeup, much more time at the start of the school year in review, making sure students have the foundational skills for that course or that content area so that they're ready to learn and to move forward. We can talk a lot, and I know Paul DeAngelis would share a lot about the social emotional supports that our students have needed this year. They have certainly missed interaction, and they have missed relationships, and they've needed a lot of help and support and time to learn how to do school and to support, their positive development. So there's been a whole lot of both individual and whole group work with students to support those needs as we've moved forward. And I think as we've shared over the course of the last, year and a half, This isn't a short game. This is a long game. We know that the adjustments we need to make and the supports we give to students, they aren't for a year, they're for 3 to 5. We'll be recovering for a while, and we'll be supporting students in every way we can. You may have seen that in the teaching and learning division, we've developed and implemented a framework for equitable instruction. And this is a way that we're working to make our instruction wildly accessible to everybody. We're looking for more inclusion. We're looking to make learning as engaging and meaningful and relevant as possible, so that the time we do have in person with each other is spent to the maximum degree possible, making learning joyful and meaningful for kids. And that's a focus we continue to have and will have for the next 4 to 5 years. So I'm happy to share more, and I could go on, as could every member on the panel. Okay, we've got a question here. Why don't we postpone school until staff is available and just extend the school year into the summer? Not a fan of doing virtual.
I believe everyone's first choice is to get through this time and get our students back into school. I do understand the concern about virtual, and parents should make the choices that they need to make. But we want to continue our school year, and there will be times, probably for the next few weeks, where we're going to need to deal with an unprecedented amount of staff impact. So I think I've said that several times, and I do understand the frustration, absolutely understand it. And yet our hope is that this high escalation will run its course rather quickly, and we'll be able to move forward as we were able to in the fall.
Okay, here's a question. Considering the high percentage of teaching staff that's vaccinated, the assumption is that their COVID cases would be not the most severe. So why can't they simply teach from at home, zooming into the classroom where the students are?
Mm-hmm. We absolutely are looking at that strategy. Does not work, of course, very well in the lower grades, but particularly at secondary. We have a large number of teachers teaching this week who would not be able to be in person. So we absolutely appreciate that strategy, and we'll use it as necessary.
Okay. Just a question to please restate the timing of when we will know what the plan is for the upcoming week. And also, is that going to be a district-wide decision, or is that going to be a school-by-school decision?
We will share our update with the community on Friday. And at that time, we will know whether it is a district-wide decision, which would suggest widespread impact, or whether it is a decision around a few schools, and the majority of schools will open, as we hope, on January 10th. So we will update our community on Friday based on the data that we've concluded this week. We will share our COVID case report on Friday, as we do every Friday. We do share our data transparently, weekly, on the COVID impact to our schools.
Has the masking requirements changed? Currently CDC recommends any mask should be worn indoors around people, with the suggestion of the KN95 or N94 masks. And will Ann Arbor schools be doing something about getting them?
Yes. So we have ordered those. I do want to share that the guidance has not changed on masking. And yet we are awaiting Washtenaw County Health Department updated guidance. So I've mentioned that a couple of times. It is possible that guidance could be adjusted, but at this time we're not aware of any adjustment to the masking guidance.
Okay. I think this one probably is going to be useful. Make sure that we answer this question just so that our building principals don't get inundated with emails. Do our school principals have the authority to decide about returning to in-person on January 10th?
Our school principals are working literally around the clock with our 3 executive directors, Ms. Parks, Miss Linden, the folks on this screen. They absolutely are engaged in those conversations with us. They know lots more detail, typically, about the nuances of staffing in their buildings. So they are absolutely a part of that decision. We kind of set 7:15 as our time frame. And I know, Mr. Cluley, we've got some wrap up, and I want to go to the trustees for any remarks that they want to share. So I know maybe you have one or two more, and then we could
I've got one more that I think is pretty quick and probably an important question. With the decision coming on Friday, is that going to be for just Monday, or are we anticipating that decision that we make on Friday will cover for the whole week so that families won't be having to make a decision on a day-by-day basis, but will be able to know the full week of their planning?
We really want the full week of planning for everyone involved, if at all possible. And yet we know that sometimes things may change during the course of a week, but it's our intention to go week by week. I really appreciate everyone being a part of this event this weekend. I'm very grateful for the engagement of our community. And please know that folks on this screen and teams in our schools literally are working to ensure that we can keep that goal of having our students in school on every day that is possible. I appreciate the support of our trustees this evening, appreciate the support of our parents and community, our students, and our tremendous staff who's made this pivot in the transition in the continuity of learning possible. President Johnson, trustees Lazarus and Kelly.
Thank you, Dr. Swift. I did notice one thing in the list of questions that seemed to not quite connect with some of the answers, and that's the definition of safety. I think when we say safety, people hear it in regards to COVID, but what I think we mean when we say safety is all of the safety that goes into operating a school. And that means having appropriate student to adult ratios to ensure that kids are well supported, that there are the right people in the building to know what to do if a child has a life-threatening allergic reaction or a dangerous behavioral situation, or a myriad of reasons that we need to ensure certain staff to student ratios to operate schools safely. So I just wanted to make that connection for folks. Yes. And I wanted to remind the community that no one individual is going this alone. The distress is real. We understand the impact on the community of school decisions, but the decisions are not made by single individuals. The decisions are made in consultation with experts, with incredible resources available for all the things that go into operating a school district. And, any one person's perspective may not be aware of all of those nuances. And so I just want to assure the community how comprehensive the expertise is that looks at all facets of this, many of which are on the screen tonight. So thank you to everyone. And to thank this team for your dedication to that type of teamwork and really understanding and hearing what the community and students and families need and just working night and day to address those. So thank you to this team.
I just want to say thank you to all the panelists and to our community for attending this town hall. I hope we answered some of the questions that have been swirling around in the community. I know some of the answers may not be as specific and detailed as you would like them to be, but there are many things that go into making this decision and running a school, the district of this size. So we do ask your patience. We understand these are very trying times for students, as well as teachers and staff and parents specifically, and just our community overall. So thank you very much. I appreciate you attending. And please be patient with us. We're doing everything we can to keep our doors open and our children in school.
I will say what the other trustees said as far as our staff and the leaders that are on screen and those who aren't. Heartfelt thanks to you all for really being in the work every single day and night, and I mean literally day and night, and people don't understand how much work that you do. So I want to thank you. Also want to thank the community, the parents, students. This isn't easy, and we understand that this isn't easy. Trustees, we have kids that are going through this as well. We're seeing it every single day. So I do want you to understand that we understand your frustration. We see this. We're frustrated at times as well. And Dr. Swift will tell you, we have some heated discussions about all of this, all these decisions that are made. But I think the most important thing to make sure people understand is that we have made the priority to have in-person instruction at any time that we can do that. And what the downside to that is sometimes we do make some decisions that feel last minute because, as Dr. Swift said, we're trying to exhaust all other options. And so please don't take that as being unprepared or being last minute. It's just that priority, and I think that's the trade-off. And so with that, we will continue to support this team. We do hope that community continues to support us, and hopefully you got some answers that you may not have, or the questions that you didn't have answers for. So thank you all, everyone in the community and everyone on the call for the time tonight.